Bringing you this, the Western Cape Health Department is increasing its COVID-19 vaccination sites. At least 53 sites will be up and running starting from this week. Now, phase 2 of the vaccine rollout program to immunise those over the age of 60 kicked off across the country just last week. Provincial Health MEC, that's Mamnoma French Mbobo, speaks to us now all the way from Cape Town. MEC, good to have you, and thank you so much for your time this morning. Now, just last night, of course, my colleague Tembeki Ilim-Khototo spoke to Dr. Keith Kluter around, of course, a plan to increase capacity in terms of these vaccination sites. But just from your perspective, how important is this drive, the increase of these sites, and what are you hoping to achieve just in terms of speediating quite more effectively and efficiently the vaccine program?
Yes, indeed. For this week, we're moving from about 19 sites of last week, which was based only in Metro. So this week is 53 sites that include the rural sites. Noting that at the end, for phase 2, we envisage about 70 sites in the Metro and 204 sites in the rural areas. We are also increasing more capacity regarding to the doses, although we started small gradually to test the systems. At least for the phase 2, ideally it's about 30,000, and then we go to the 60,000 per week, so that by the time we are done with the phase 2, at least with the 26,000 actually per day, where we are going to.
Yeah, I mean, see, I'm having a conversation with the SA Pharmacy Council this very morning around, the process of approving a vaccination site. Vincent Lala quite making it clear there from the SA Pharmacy Council that not just anyone can erect a tent and claim to be assisting, government in terms of, having a vaccination site and administering vaccines. How important is it for people to be aware? Or how do we then identify that these sites are part of those legally approved by government and therefore quite, safe for me to go and get administered there?
Yes, the accreditation is done by the National Department of Health based on the various assessments that they will have conducted even prior, noting that the vaccines, they go directly, they don't come via us, public health, they go directly to the private site, whether it's a pharmacy or it's even in the private hospital. So that's why it's crucial for people to ask for the confirmation that comes from the Department of Health. And also how will the person will have access to the vaccines even prior. But it's also crucial that for the people must also even go there once they already have the confirmation of the SMS, because we want to avoid a situation of the whole disorganization where the people now, where the vaccines ended up maybe finishing off, maybe early, because of the high number of people, and then it becomes quite a chaos when people don't end up getting the vaccines.
Right. We got confirmation this morning from Professor Berry Shu, part of the Ministerial Advisory Committee, that we're definitely facing a third wave. Some provinces also, unfortunately, in this third wave. As a province, how are you preparing for this in terms of capacity, while equally ensuring that you have a successful vaccination drive? I mean, I saw in the papers this morning, addressing certain issues around bed capacity, oxygen, just amongst other things.
Yes, our total number of beds specifically on the field hospital, they still remain, because during the second wave, we made sure that we have got additional beds in regard to the field hospital. For example, the Mitchells Plain Field Hospital was still empty at the time that at least we are not having high numbers. The Sonstral Hospital outside the Metro, the one also in George, and also the other one, the Bracken Gate, where we converted the warehouse to be as such. With a critical care beds capacity, which is, in the public sector, there will always be a challenge. There is also a private hospital that is also on standby, just in case we might be able to need more critical care beds. Similar with the oxygen supply, which we see now that we are increasing the utilization of the oxygen. So we are ready in regard to that space. But it's also crucial to pick up some of the cases, not only through individual testing, but also through the surveillance of testing water, from the municipalities, which is the dirty water, so that one can have an understanding that if there are any outbreaks or there's a high level of the strains of the COVID that are happening throughout, not only in the metro, but in all the other municipalities, it gives us an indication when people, even though they haven't been tested yet,
right.
But when you look at them of the water sewage, that there are some of the COVID strains that are already there.
All right, MEC, we have to leave it there, but thank you so much for talking to us. That's MEC of Health in the Western Cape, Noma French and Bob.